activists and civil society have raised the alarm over the dwindling number of condoms being distributed across the country. In light of South Africa's fight against HIV/AIDS, this drop is concerning. According to data published by the Health System Trust's District Health Barometer, government distributed around 45% fewer male condoms in 2022 than it did in 2018. The distribution of female condoms also decreased in the same period. Let's talk about it with the Health Department's Acting Chief Director for HIV/AIDS, Petrus Khoza. Petrus, good morning. Thank you so much for your time. The obvious question is why?
Yeah, good morning, Iman, and good morning to your viewers. Yes, we actually can confirm that we are seeing a reduced distribution of male and female condoms in the country, and there are various reasons that actually contribute, or factors that contribute to that. And this decline, based on I know that you're basing it on the HST Barometer report that they just issued, but even if we look at the HSRC study, as early as around 2013, condom usage has actually reported condom usage has always been declining, on the decline. And as a department, when we then went out to reach out to the population, especially youth, to find out what the contributory factors might be, one of the reasons was to say maybe we should actually get condoms that are much more comparable to the commercial ones that we have, rather than at that time we're distributing the choice condoms. So did go back into the drawing board, changed based on the inputs that we had from the communities, and then launched the Max condom that was launched by the country president. But we still see a reduced kind of distribution. More specifically on the 45% that's reported by the HST report, it's the contributory factor to that. I think it's more of a legacy challenge that we had on the COVID lockdown and manufacturing, and the challenges around shipping, because our condoms are actually sourced from Asia. So that's one of the contributory factors. We also had in the previous year, in 2022, challenges with testing of batches in the SABS, but that challenge has actually been overcame, and we're actually seeing a much more improved availability of condoms.
So there's a combination of things, Petrus. The one are the operational challenges, and the other are the behavioral challenges. The operational ones, as you're saying, there's a bit of a legacy issue there around COVID, impacting those supply chain or the supply. The SABS certification, a new tender having been issued. So there are these, sort of operational glitches. Let's maybe move to the behavioral part and the messaging. So you listen to people, as you say, around the suitability of certain condoms. You're in that redesign process, trying to make something that's more suitable. But still there's that huge missing link in the uptake of, in the uptake of condom use. What are you doing to breach that divide? How is that changing in terms of your approach in getting the message out?
Yeah. So on the behavioral side, I think opportunities that we have, including this one of being able to reach out through the media and reach out as many people as possible. That gives us an opportunity for us to be able to actually share that message. There's a challenge around the condom use. When we looked at the HSRC study report issued for 2022, in terms of the a questionnaire that they had designed, one of the questions that they have there was to say, did you use a condom in your last sexual encounter? And what the response there, just then gets to give you a sense of condom utilization. So that has actually been reducing as well, and I think it could be. We know that in some cases we attribute. In other corners it's attributed to the HIV prevention, other modalities that we have like the PrEP and all that. But there's no kind of scientific evidence that we have that actually has demonstrated that. So we still then continue to encourage our communities to actually use condoms, and we actually do say use condoms and use them consistently. It doesn't help that you actually get to use a condom today and you don't use it tomorrow, but also the issue around having multiple concurrent sexual partners. That as well, just as our intervention or response, the messaging has always been that we actually would like to discourage communities from doing that, but in instances where they happen to be in those kind of situations or arrangements, they then should use condoms all the time. So condoms remain the cornerstone for our HIV prevention. I mean, even for STIs, for pregnancies, unwanted pregnancies, and all of that. So it's not that we actually should only be using condoms for prevention of HIV or acquiring HIV or STIs, but also family planning as well. So we really would like to urge and encourage our communities to do that. We work in partnerships with, especially because we know that the bulk of our population, I mean, the highest area where we have HIV transmission, the highest area where it's reported that we actually do not have utilization of condoms has declined, is amongst the youth. So we actually work with our partners, Love Life and Soul City, focusing on youth to really help us in disseminating this message and encouraging the youth to actually to use condoms.
So again, going back to the distribution issue, because, both are kind of codependent, to share the message on condom use, create that discipline around, when you're having sex, wearing a condom also depends on it goes back to the availability of having condoms to do so. And it's interesting that, there were certain provinces with a higher distribution drop than others. Just talk to us about, now that this SABS hurdle around certification has been overcome, you say, when are, especially provinces like the Eastern Cape, which apparently distributed 65% fewer condoms than they had in the previous financial year, when can these communities expect to have full strength distribution, back up and running again?
Yeah. I would say immediately. My response would be that condoms, I mean, the increase of availability of condoms is happening as we speak. So we actually do not have, maybe I must put it on record as well, that we do not have a stock out of condoms. So it's not like we do not have condoms at all. It's just that in terms of the levels of stock holding that we usually would have as a country, but then break it down to provinces and districts and then facilities and any other area where, because remember, we don't only distribute condoms within the public health facilities. We actually do partner and distribute condoms in taverns, in saloons, in all these other non-traditional kind of areas there where health usually in the past used to distribute condoms. So those condoms in terms of stock holding that we have in what we call the primary distribution sites. These are warehouses in the provinces. Their stock holding levels is actually increasing. It's actually not at the same level, not increasing at the same level because, again, there's an issue around logistics that we need to manage with the contracted service providers as well, because if we're not on top of that as well, it becomes, we have a skewed kind of availability or distribution where a supplier would prefer to distribute to the easy to reach kind of areas rather than the far-flung kind of places. So we are managing that. In fact, just last week as we were wrapping up the financial year and preparing the reports, we actually were seeing a quite increased, on average about 15% increment generally of the stock holding in various, all the 52 what you call the primary distribution sites. These are our warehouses.
So just to reiterate, Petrus, when then will the requisition be filled as it needs to be, wherever there are shortages right now?
Yeah, in fact, the requisitions, I mean, this it's a man, if I may just explain it. The issue about condoms take about there's a lead time. So you have something around that takes to something between 3 to 4 weeks. Currently, it's taking 4 to 6 weeks. The delays as well, the current delays that we're seeing. So it's not like the requisitions are not filled, the orders are not placed. They are placed. Suppliers have actually done the manufacturing. But then, as you know, there's also another element that is now affecting us in terms of logistics, and that's the issue with the backlog at the harbour, because we use the sea to import condoms because of the sizes of boxes of those consignments. So the only way we bring condoms in the country is through the sea, and as you know, the port of entry and the harbours have a backlog as well. So there are those. So it could be that some of these shipments that are coming through are actually delayed for processing at the customs and ports of entries. But as soon as those are available, they'll then be redistributed so that we are able to favor the areas that are reporting kind of a lower storage. So we, like I said, we are at about 15% improvement compared to the last quarter that ended December.
Petrus, please do pardon my ignorance, but I was under the impression that we do manufacture condoms in South Africa. Do we exclusively import them?
No, we do. There is a local manufacturing of condoms, but again, the contribution to that in terms of proportion, it's actually far less. It's even less than 10% of the total need. On annually, with our target for condoms is about 700 million male condoms and about 40 million female condoms. The raw material for that is actually latex, and latex is only manufactured in Asia. So even if we do have a plant in South Africa that manufactures condoms, they still rely on the raw material, which is latex, that has to come from Asia, and that also comes through the same kind of channel that the finished products like other condoms. The 90% comes through our waters and through the ports of entry.
Raw material aside, it's just staggering to me that in a country where we have high levels of HIV infection rates, and this is confirmed every year, that we are producing in order to deal with that pandemic effectively of HIV infections. We are only able to provide 10% of what we need in terms of that prevention drive. Is this going to change anytime soon?
Yeah, well, Iman, I can share that I think about 3, if not 4, 5 years ago, with the Department of Trade and Industry, we worked with Treasury and ourselves and the trade industry to really encourage the business in South Africa for manufacturing of condoms, because we thought that was going to be, a quick kind of win for us, given the need that you so have expressed. But it proved that even the companies that actually went into that direction, about 3 of them actually closed because our conditions, weather conditions in South Africa, we are told, are not suitable for condom manufacturing. There are issues around the temperature, issues around the dust particles, issues around many other factors that goes into specifications for condom manufacturing. So some of these condoms will be then finished products, be subjected to SABS testing, and then those batches then failed. And when the batches have failed, then we can't really distribute them. And then it turned out that these manufacturers were at a loss. So we currently only have one manufacturer that's giving us supplying us condoms, but also they are struggling to reach the targets that we have agreed upon based on the same reasons that I've alluded to.
All right. Well, thank you for stopping by and just sharing with us the latest on this condom distribution story in terms of the declines. Hearing there from our guests that Petrus Khoza, that the situation should kind of return to normal over the next couple of weeks, and just sharing with us some of the issues around the supply with regard to certification and impact of the COVID-19 pandemic.